Every woman deserves to be heard, supported, safe, loved, encouraged, and cared for. My name is Elizabeth Garcia. I'm an advanced practice registered nurse, certified nurse midwife. As a labor and delivery nurse, I got to experience delivering babies when the doctor didn't make it to the delivery room. And I also realized that women deserve more. I get the honor and the privilege of being with women when they are the most vulnerable, but yet the most strong. A certified nurse midwife is a registered nurse that has gone on for further education, either a doctorate or a master's in science, and they take a licensure exam to become certified, and they're licensed in the state where they practice. As a certified nurse midwife, I am able to care for women throughout their life spectrum, from their first period through childbearing, past menopause. I not only help women during pregnancy, preconception, pregnancy, childbirth, postpartum, breastfeeding, but also gynecological care, menopause, hormone replacement therapy, refer them to physical therapy for pelvic floor dysfunction, sexual dysfunction, family planning, and then teaching them also, again, going to the core of midwifery, teaching them the basics on how to just be healthy and continue to grow healthy families. I think the biggest misconception between a nurse midwife and an OBGYN is that a midwife only does home births, where a physician obviously is in the hospital. But no, nurse midwives also can practice in a hospital. Also that nurse midwives can't offer pain relief options, which we can. Women that start off with midwifery care actually get more care or double care because we do work very collaboratively with our physicians so they don't lose their nurse midwife. The biggest misconception between choosing a nurse midwife and an OBGYN, I think, would be that midwives only deliver at home or in a birth center and they don't deliver in a hospital. But nurse midwives do also deliver in a hospital. As a certified nurse midwife, I have the honor and privilege to be with women during such a special moment in their lives, the birth of their child. They can choose anyone. They can choose to go anywhere, but that they continue to come back and be cared for by a nurse midwife. I feel the love. I feel special. I feel that they feel safe. They feel cared for, and I love it.